Hello, everyone. Good morning, good afternoon, good evening, from wherever you are joining me from. Welcome to Mentor Series 5, where I will discuss the specific strategies for nursing exams. Last series, I gave you the general strategies to writing nursing exams. In this series, focus on the specific strategies writing nursing exams. For every nursing exam, there are certain basic concepts that are deployed to set the question. If you are preparing for the exams, it's important to understand those concepts so you will know the thinking of the examiner, some of the key words, which we call the strategic words, that are being used to set the questions. By so doing, you will be able to build your capacity before you sit for the exams. So what are the main concepts of any nursing exams? Whether in Asia, whether in America, whether in Europe, there are certain key concepts that most consultants will use to develop the questions. There are four main concepts all over the world that has been used. Share that with you. One, most of the questions are based on critical thinking and reflection. How you as a nurse or a midwife is able to think critically, solve solutions, solve problems, find solutions to problems within your domain of practice. That is what this aspect is all about. Your ability to act and think fast within the shortest possible time under a very pressured environment with an array of problems. Your ability to prioritize and pick the most effective decision that you have to make to save somebody's life in your practice. Very important that you are able to do. Again, clinical competence, your ability to demonstrate that you are actually competent enough to be able to act. So there are certain clinical somatic areas that you must be able to demonstrate that yes, you are able to, have those practices. Say somebody is having an asthmatic attack, there are certain key competency skills you are required to treat an asthmatic patient, or someone have diabetes mellitus. There are certain key competency skills that you are required to demonstrate. Your ability to show that to the examining board or the nursing board shows that you are ready for the license. Now, most of the questions are based, the whole concept of nursing all over the world is on the, the nursing process. So the questions are going to be developed based on the nursing process. And I'll share with you how some of these things are done. In many of the questions, in fact, the questions are actually put into what we call high thinking order or high order questions, where they rank them according to the Bloom's 2 taxonomy, which is a benchmark that is used to spread the questions across all the domains of knowledge. So the candidate needs to understand that memorizing things and going to the exam is not enough for you to pass the exam, for example. So you should be able to analyze, you should be able to synthesize, you should be able to evaluate, and I'll share with you how you can go around and how to detect those questions when you are reviewing your question bank, how to assimilate those questions so that you will be able to pass the exams once. So the nursing process, we all are aware during our training in the nursing school, we are aware of the nursing process, popularly called the ADOPI, where you have to assess your patient. After assessing the patient, you need to collect data. When you gather the data, you must analyze the data, make a diagnosis. Then do the diagnosis, we call it the nursing diagnosis. And you will do that based on NANDA, the North American Nursing Diagnosis, autonomy or framework. You use that to develop your nursing diagnosis. And then you plan, you do your outcome criteria, outcome identification and the criteria, where you begin to set your objectives and in a smart manner and indicate the evaluators, which are the outcome criteria. Then you plan, where the planning talks about your nursing actions or your orders that you will put in place, be able to solve the patient problem that you identify and that you have made diagnosis. And then you also then continue to look at the nursing intervention, how you will intervene, or nursing key clinical competency skills you need to be able to solve the problem. And then, of course, evaluation, trying to reassess based on the outcome criteria that you set for yourself, how you are going to achieve that. So the questions normally are composed based on the Bloom's taxonomy. And like I said, there are questions that are going to be about testing your knowledge, how you can recall, the ability to retain and recall. There are questions that will be testing your understanding or comprehension, ability to grasp the meaning of certain concepts in the nursing practice, ability to summarize, ability to describe or report, or even paraphrase or explain certain concepts. Then from there, the questions will move to another level, which is application, the ability to use existing knowledge, new context, practice to calculate, to implement, to operate, use, illustrate, more or less how you can translate what you are learning to clinical practice. Then from there, the examiner will move to another level of questions, which we call the analyze. You have to be analytical. Ability to explore relationship between concepts, relationship between cause and a particular disease condition, for example, how a particular factor can lead to a particular disease. Ability to compare and contrast and organize and differentiate. How can you differentiate anginal pain, for example, from myocardial pain? The two are chest pains. By your ability to differentiate between anginal pain from myocardial pain shows that you are analytical. Then we have evaluation, making judgment based on sound analysis. So when you analyze, you in other evaluation is more or less like trying to reassess and make a judgment whether what you implemented first or the care you instituted, you have yielded positive results or not. And remember, in evaluating, you may also want to prioritize. You may even want to critique the interventions. Perhaps the interventions that were put in place are not good enough, and then you can make a recommendation there. Then the highest level level of questions is about the create, so where you have you use existing information to make something that is new, trying to invent, trying to develop, and trying to design something. So you can be given a particular scenario and you are being asked to formulate some key nursing diagnosis, formulate some key interventions per clinical practice that can be used to address that problem. And so you must open your mind to look at how you are going to look at all these things. Let me use Ghana as a case study. The Nursing and Midwifery Council of Ghana have been able to synthesize what they want each candidate to learn from, or the number of questions they anticipate to ask you. So from the domains of knowledge, which is the knowledge, the comprehension, the application, the analysis, the synthesis, the evaluation, they have come out with, some number of questions they want to ask you, and they have broken it into percentages. So in the case of knowledge, comprehension, and application, you should be able to answer 20% percentage in all of that. That will be 60%. Then the rest of the 40% of the questions are spread across analysis synthesis. Now, what this means is that if you are preparing, you should try to build your capacity to know first, try to understand first, and try to apply. If you are largely able to do this, you have a higher chance of passing the exam because you can answer about 60% of the questions already. Because 36, because you have 180 objective questions in the case of the Ghana situation. So 36 questions, that's 20% of the 180 questions. Another 36 questions, that's 20% of the 180 questions. Another 36 questions, that's 20% again for application. Then for analysis, you have 15% of the questions. It's about 27% right, that you will get about analysis. Then in the case of synthesis, they are expecting you to look at about 15% of the question, 25%. And then evaluation is just about 10%. So the questions are spread like that. And if you add all these figures, you come back to the 180 questions. So if you are the type who think that you are preparing for these exams and you will just memorize some concept and go to the exam board and expect to pass the exams, you are only going to answer just 20% of the questions, and the rest of the questions, sit down there and you'll be wondering how you answer them. That means you are doing it. That's why I am showing you how the examiners conceive the ideas to give you the question. So you can appreciate how to go around your own personal studies when you're preparing for the exam. So you don't go memorizing concepts, just get questions and you're memorizing without trying to understand the content on which those questions are developed. When you do understand the concept on which those questions are developed, chances are that you will be able to answer questions. And so this diagram also displays the high order thinking with the revised Bloom taxonomy. Here, the essence of this particular slide is to show you how the questions are actually, spread across. And if you look closely, you will see that with the remember, that is where the examiner will be the one leading the questions. The examiner will be the one leading the questions. So it will be like where, it will be like who is this or what is this? It is the what and the who that the examiner want to use. And even with your understanding, it's still the examiner that is leading the questions, like how, like where, like when. Okay. Now, those are the phrase, the key words, which we call the strategic words that the examiner will use to ask. So you should know the strategic words in each question that the examiner is looking for. When you know the strategic word, the data in the question will lead you to answer the question. Just analyze the data that is embedded in the question, and that one is enough to be able to guide you to answer the question. Don't go outside thinking and saying, what if, what if? When you bring the what if, is that you are not trying to introduce your own concept and interpretation into the question, and you will not be able to get the answer. You may end up answering the question wrongly. Then from the lower level, which is the teacher-led questions, the teacher-led questions are the lower level questions. Then from there, it goes to the middle level question, which have to do with the student-centered. Okay? The student-centered. So now we want to stimulate your own thinking, and that is where we begin to ask questions like, how does this work? And how is it used? Or how do you use this? We ask questions like, what is the reason for this? And we ask questions like, why is it this? Or why does it work? What is this? So for example, you will see that we will ask a question about blood transfusion, and we want to know that which type of we are giving blood transfusion for a patient and we're using fresh blood. So what is the reason for using fresh blood? We want you to be able to go back to your thinking and be able to analyze the concept and tell us that fresh blood contains clotting factors. And so it is the best blood to give to a client who have hemophilia, because in hemophilia, the clotting factors are affected. So that thinking and connection, meaning you are able to analyze concepts together. But once you are not able to do that, then it's problematic. So the questions actually, if you go look at NCLEX, for NCLEX, they start from the lower level and start graduating. So when you answer questions within the remembered domain, they move to the understanding domain. When you answer questions there, they move to the applied domain. When you answer questions there, they move to the analyzed domain. In fact, if you are able to get the 75 questions mark, they will even proceed to the rest. They will stop. They will end the exams. So there are people who, the first 75 questions in NCLEX, they pass and that ends it. When you understand the concept, how the questions are developed, it is easier for you to be able to navigate around and know that. And the essence of bringing this slide is to let you understand that there are strategic words that are used by the examiners to formulate the questions. That is what I am displaying in this slide. Okay. When you come to the evaluation, the questions are towards about effect, impact, and results. Effect, impact, and results. Okay, so what if this happens? What will happen and what could happen? So it's about anticipation. And when you get to the creation, which is the highest level of thinking, that is where we look at design, we look at development, we look at the plan of care that we want to put in place for the patient. We look at how you can be innovative to try to solve problems. So they say that you are going to administer oxygen you are going to do nebulization to the client. For the client, and you enter the ward and you don't find a nebulizer machine, or the nebulizer machine is faulty, what is the most appropriate action of the nurse? And you will see responses suggesting that, you should call the biomedical engineer to work on the nebulizer machine, or you should change the drug, look for a substitute drug to give to a patient, and use other available method to administer the medication. You will want to explore the resources around the ward at that time, or the department at that time, to see which resources can help you to nebulize a patient, even without the nebulizer. And if you do have oxygen apparatus in the ward, you should be able to use the oxygen apparatus to administer the nebulizer medication without necessarily using that. So that creating that innovativeness, you will test that in the exam to see how innovative you are, because the nurse must not be a straight-jacket person. You should be able to think outside the box and find solutions to problems that patients are confronted with. And it's important to also take note that if you take the nursing process, so that's about the Bloom's taxonomy. If you take the nursing process, you are supposed to look at assessment first, collect data, you review the data by using the assessment techniques, the inspection, the percussion, the palpation, the auscultation, and all that. And all the tools, the vital signs tool, the pain rating scale, the Glasgow coma scale. You must know all these clinical tools and how to use them and how you can apply them to clinical practice. You know, if somebody vital sciences, what does it mean in clinical practice? For example, if somebody is having a temperature of 34, what does it mean in clinical practice? If someone is having a temperature of 39, what does it mean in clinical practice? If a Glasgow coma scale is, let's say, 5, what does it mean in clinical practice? If it is 3, what does it mean in clinical practice? So your ability to be able to apply it when you gather the data and be able to synthesize and apply that to clinical practice is very, very important. And the examiner is going to find out from you. You should be able to formulate nursing diagnosis. Here we are talking about your ability to look at the patient actual problem or risk problem and relate that to the etiology, the pathology, or the cause of the problem. And indeed, it's important that you remember that when you identify a problem with a patient, you need to continue to use NANDA to look for the appropriate diagnostic level to draw the diagnosis. Then you write down your diagnosis, and then you can move to the outcome identification, where you should set your objective and outcome criteria. Now, each diagnosis must come with an objective that follows the SMART rule. And the SMART rule, what I mean by the SMART rule is that each objective must be specific to the condition within which or the problem identified. It must be measurable. It must be something that you, the nurse, can measure. It must be something that you can attain. It must be realistic, and it must be time-bound. So you cannot set an objective without a time frame. You cannot just say that patient will be relieved of, let's say, chest pain without telling us the time frame within which you are anticipating that to happen is problematic. And then for each particular objective, it must be followed with 2 appropriate outcome criteria. Appropriate because you cannot be saying that you are assessing pain and then you come and be talking about fluid deficit and excess in the distance. No, you must be directly be looking for measures or criteria or criterion that can be used to evaluate when somebody is in pain or is not in pain. And that will help you at the level of evaluation after you have planned and implemented the care for the patient. At the planning stage, it's about your nursing orders, and you have to develop your orders for the diagnosis. That's important. What do we mean by that? It involves determining the strategies or the course of action the nurse have to take before you can implement the care that you want to do for the patient. So what are the strategies that you need to put in place to, develop the care for the patient? That's what we mean by the plan. And to be effective, the client and the family must all be involved in your planning of care for the patient. Never you plan a care for a patient alone without a family. It's against the recommendations of the WHO, which now they are even trying to add a community to some extent, depending on the nature of the condition. That your client is not just the one sitting in front of you. Your client also include the family, and indeed, it includes the community from which the client is coming from. And so we need to remember all these concepts when you are preparing yourself for the exams. Remember that an order is your action, the nursing action that you set. That must be prioritized on case-by-case basis. So if, for example, a patient is having difficulty to breathe, and you are coming to, actually manage this patient, and you get there and you are already going around looking for an oxygen apparatus to come and administer oxygen, that is not the right thing to do. Perhaps you may have to look at the interventions that you want to do for the patient and begin to put them in order of priority, all right, in order of priority. Say that the ones that take precedence comes first, so that you deal with that. So you may want to even try to position the patient in the first place before you even look for the oxygen. In any case, when you bring the oxygen, you will not leave the patient lying in supine or prone position to do the oxygen. You will certainly have to position the patient. So why don't you rather position the patient and go and look for the apparatus? Because the positioning in itself will reduce some stress on the chest and will help the patient to breathe. That is why you need to begin to think about this part. Indeed, after that, you have to look at the implementation. During the implementation, we are looking at intervention that you have to put in place to describe your actions and you give rationale to the actions that you have implemented. But technically, when we say that you are implementing any nursing action, what we mean is that it means you are giving treatment to the patient based on your clinical judgment and the knowledge that you have as a nurse, that you think that this will help to enhance the client outcomes. So things that you have to do, actions that you have to take, treatment that you have to do based on your knowledge as a nurse, that will help enhance the clinical outcomes or the health outcomes of the patient. We call that intervention. And the intervention is your nursing action and a description of the action. Some of the questions will present that, or a rationale of the action. So sometimes they will ask you what is the rationale behind it. It's a form of an intervention. And the questions are normally categorized into two main questions. I must let you know this. The questions are categorized into assessment and implementation or intervention. So assessment questions are there where you have to, the question is asking you what data will you collect or what will you do and that kind of thing. Then we have the intervention questions, and the intervention question can either be a description of your action or the rationale for the action. And you need to keep this in mind. And I'll demonstrate to you how some of those questions looks like. And so every intervention that you set for your patient must be prioritized, Then we should also remember that interventions are technically used to monitor the health status of a patient. So sometimes you might not necessarily be looking at the actions. The question may be asking you things we have to do. So when we are actually talking about intervention or implementation, we are boxing the planning and the implementation together. So if you are monitoring the health status of a patient, it's part of an intervention. If you are trying to prevent or resolve or control a particular problem in a patient, it's an intervention. If you are assisting the patient to do a particular activity, Virginia Henderson identified some 14 activities of daily living. In fact, it was 12 that was modified later by Roper and Logan to 14. Those 14 activities of daily living actually are very important in actually helping the patient to deal with these things and promoting optimum health status of the patient and independence of the client is also one of the things that we can use interventions to do. So there are three main types of interventions that the nurse must do. One, the nurse intervention can be independent. The nurse intervention can be dependent, and the nurse intervention can be independent or collaborative. What do I mean by that? If you are talking about independent nursing actions, they are the activities that the nurse himself, based on his license or the skills that he has acquired or the knowledge he acquired during his training, that he or she will initiate and monitor the results and make sure that those actions are taken. So if you come and assess your patient, gather your data, develop nursing diagnosis, come out with nursing order, go with interventions and all that and evaluate, these are independent nursing interventions. But you are the one who is actually using your skills and your knowledge to be able to do that. But if it is that the intervention that you are carrying out is based on an order from other members of the team, like a physician or a nutrition or dietitian who comes to order, and you are implementing those orders to enhance the recovery of the patient, then that becomes a dependent. That action you are taking, the interventions you are taking becomes dependent interventions. Then we have the collaborative ones, where all the team members are coming together to think about how to help solve the patient problem. So carrying out in collaboration in relation to other members of the health team, where the activities have been done across all the areas. So you need to appreciate these answers that are trying to talk to you, the nurse. Don't relinquish your actions as a professional nurse to other members of the team. If you have interventions that you have to do for a patient, and you have independent interventions, and you have dependent interventions, and you have collaborative interventions, the prioritized one as a nurse should be the independent interventions. Okay, so for example, if your question says that a patient with bronchial asthma, patient admitted with bronchial asthma is to undergo treatment. Which of the following interventions is most appropriate? And then some of the answers now says that the nurse should monitor the SpO2 levels. Another response says that you should administer prescribed salbutamol. Another response is that you should administer prescribed oxygen. All right. Another intervention says that you should take samples to establish the arterial blood gases from the lab. Now you realize that some of the responses are talking about administering prescribed. It means that it's dependent. Somebody has prescribed, you are going to give. So your own action that you have to monitor and take a decision, take precedence before you talk about the dependent one. So you really need to understand this concept. So when you see the question, there is no magic around it. It's not rocket science. When you get the concept, you don't care how the examiner wants to formulate the question. You will always be able to pick up the answer. All I'm saying is that you should be able to build priority. And priority is something that takes precedence in position. And you have to consider the most important among the several items or interventions that you have arranged to implement for your patient. And your decision-making process, that is very, very important. You must rank it. And that is what we talk about critical thinking. All right, that's what we talk about, the critical thinking. That's what we talk about, the high order thinking questions. And you should be able to do this to enhance the outcome of the patient. And there are so many ways you can follow to set priorities. Some of the questions will come in and it's asking you, what is the most appropriate action of the nurse? What is the least action of the nurse? So they are looking at prioritizing and deprioritizing. Most appropriate is talking about prioritizing. Least action is talking about deprioritizing. And so with priority, you must start from the highest priority, which is like, the airway, the breathing, the circulation. When you are finished with that, you use the Maslow hierarchy of needs, the basic needs. So breathing, feeding, and all the basic needs according to Maslow, you have to look at them first. If you are finished looking at that, then you can go to what concerns the patient, what the patient is telling you that he or she wants. Sometimes the patient can be telling you something that he wants, but you realize that he has other problem that is highest priority, maybe airway or breathing or circulation. Is that okay? The patient may be telling you that I cannot urinate, but you realize that the patient cannot breathe. But you have to look at the cannot breathe first before you come and look at that. The patient may be telling you that I cannot pass through. That is his problem. But you are realizing that the patient is bleeding. You have to go and arrest the bleeding before you come and deal with the stool. So yes, when you are finished looking at those priorities, then you can come down to what the patient wants or consider something that is very important to the patient. And then you can now look at actual problems before the next problem. Problems that are present at the moment that you have conducted the assessment to collect the data. Pay attention to that one before you proceed to look at the risk problems. And so if you look at the Maxwell hierarchy of needs, we are talking about things that is about breathing, about water, about food, about shelter, about sleep, about clothing, and reproduction. So that is the physiological needs. When you move out of the physiological needs, you can then move to the safety needs. Okay, security, employment, resources available, the health status, and the properties. Or from there, you move to the love and belonging, where you talk about friendship, intimacy, the family, okay? And then you can move to the esteem, where you talk about respect, where you talk about self-esteem, the status, recognition, freedom, the strength of the patient, and then finally self-actualization, the desire to become most, influential or what the person can be. So, but most of the time, we just end around the two lower levels, the physiological needs and then the safety needs. We don't even go to love and belonging within the context of the way and mental health, then you can proceed to the other higher levels. So you must be able to look at the client, you must be able to look at unstable conditions among clients and prioritize that one before you go to stable conditions, right? If you enter the ward and you take over the ward, there are some patients that needs to be given precedence. And there are other patients who don't need precedence. So they will give you patients and be asking you to classify them. Aged client, middle-aged client, children, and with an array of health problems attached to them. You should be able to look at the one who can be stable. Then who is unstable, then later on you can consider those who are stable with their conditions. For example, you need to attend to client with fever before you can attend to client who are scheduled for maybe therapy in the afternoon, for example. Or for example, you need to attend to a client, let's say, have difficulty to breathe before you come and attend to somebody who is asking you to feed the person, for example. So you have to be able to balance, to look at that so that you don't go to the ward and remain on patients who don't even need your attention and leave patients who rather need your attention as a registered nurse. Consider the amount of time and materials or equipment required to care for the patients. And that is very important. All right. So if you are prioritizing, look at the time that you will consume in doing that and look at the materials you will need to do that. If you don't need so much time, then you go ahead and just finish it up and go to the next test. But if you need so much time, it will deny other patients from getting attention from you. You will need to look at them, then you come to the other ones. All right. And even if you need some equipment. So for example, attending to a client who required dressing change for a post-operative wound before attending to a client who requires health teaching, okay, for a discharge. So you are going to educate the patient on a condition who is going home. But there is someone who needs you to change the wound or to dress the wound. Go and attend to the wound, then you can come and educate the one who is going home. Don't go and be educating the person who wants to go home about his drugs and all that, which you have to sit down and do a whole lot of stuff. Then you now come and be talking about person. Now, always remember that client before equipment. So if the prioritization, some of the answers are talking about equipment, change IV line, or do this. Meanwhile, there are certain things that are so directed about the client. Talk about the client first. Attend to the client before you attach the equipment. So client before the equipment. Assess the client before checking the IV fluids, for example, or looking at the catheter, for example, or looking at the drainage tube, for example, or what the content of the drainage bag. So they will tell you that a patient have returned from theater and is with a chest tube. Okay, and they are now asking you the next that what is your most appropriate action? And then they say that look at the content in the back. I mean, that's not what it should be. You should be your attention. It should be the patient first. Attend to the patient first before the content. So when you get this concept straight away, you don't care how the examiner wants to ask the questions because you do understand his thinking and how he wants to go around setting the questions. Then you plan the interventions. Okay, you plan the nursing interventions. Okay, the nursing orders should be direct before you look at it. And that's very, very important. Remember that you must assess before you come to, intervention. So assessment before what? Intervention or implementation. So remember that most of the questions are going to be categorized into these two parameters. So let's see some few examples. So this one says that the primary nurse asks a clinical nurse specialist to consult on a difficult nursing problem. The primary nurse is obliged to implement the nurse specialist recommendations, report the recommendation to the primary physician, clarify the suggestions with the client and the family members, and discuss and review the advice strategies with the clinical nurse specialist. Now, if you look at this question, it's talking about you, the registered nurse, finding a very complicated problem that you want to solve and you're not getting, and you want to ask an opinion from another staff who is more experienced than you. So it may be the nurse in charge, it may even be a doctor or whoever is a specialist within your domain and is there. When you are going to ask somebody for something, or you are seeking an opinion from another colleague, it is always important that you try to exhaust all the options and try to understand so that next time you can also know that when there is this problem, this is how to go about it. So questions like this, take your time and look at it. One of the answers says you should implement the specialist recommendation. What are they? Have you even considered them and want to implement it? You, the nurse, must also try to look at it, why it is, because without a rationale, never implement any action on a patient. Then report a recommendation to the primary physician. No, you are dealing with the next specialist. Why are you jumping to the next person? You need to actually look at who you are dealing with and what the person is telling you to do. And the third answer says that to clarify the suggestions with the client and the family. That one is even a no-go area. You are dealing at the professional level of planning of care. You have no business proceeding to, if you like, the client family. And of course, you will need in some instances to plan care with the patient and the family and discuss with them. But in this case, it's a special problem you are discussing among the clinical specialists. You do not want a situation where you want to rope the patient in. When you yourself, you are not even clear with the concept of care you want to give to the patient. So the most appropriate answer in this case should be that you should discuss and review the advice and the strategies that the clinical nurse specialist is telling you so that you can also assimilate before you implement. And that is very important. Hope you got that correct. Now let's see the next question. To initiate an intervention, the nurse must be competent in 3 areas, which include the knowledge, the function, and specific skills. the experience, advanced education and skills, finances, leadership, autonomy, and skills. Now, if you look at this, every nurse is supposed to be able to know. You come to the school or you go to the nursing school because you want to learn to know. But when you know, you must understand. And when you understand, you must build some wisdom, and the wisdom will allow you to function as a nurse, and therefore you will develop some common sense, which will give you some specific skills. So that clearly is sitting there at the first answer. So the other ones that are talking about experience, experience is built after you have been engaged in practice for some time, so it's not appropriate. Leadership, yes, at the lower level, you will need to demonstrate some leadership, but knowledge is still important. Autonomy, leadership skills, no. So the first answer is the most appropriate. I hope you got that one. Example 3, the nurse is caring for a hospitalized client with a diagnosis of heart failure, who is suddenly complaining of shortness of breath and dyspnea. The nurse should take which immediate action? Now look at the question very well. Which immediate action? The commanding word in the question is which immediate action? So let's look at the answers. Administer oxygen to the client. Prepare to administer furosemide. Elevate the head of the client bed. Call for the healthcare provider. Remember, one of the rules says that patient first before equipment. Independent nursing action before dependent nursing action. So if they are talking of immediate action, your independent nursing action must come before the dependent nursing action. Administering oxygen is about independent, it's about dependent. Administering prescribed medication is about dependent. Calling the physician is even a no-go area. So you are torn between elevating the head end of the patient bed and then giving oxygen. So these two are the ones. So, but administering medication and administering medication and calling the healthcare provider and all that, those ones doesn't come in. So remember that you need to elevate the head end of the patient bed. So when you know the rules, you don't really care how the examiner wants to ask the question. I hope you got that one correct. Let's see the next question. A client with a diagnosis of cancer is receiving morphine sulfate for pain. Remember, morphine sulfate for pain. The nurse should employ which priority action? Remember, priority action in the care of the client. Priority action in the care of the client. So here, monitor the stools of the client, encourage fluid intake, monitor urine output, encourage the client to cough and deep breathe. Remember, we say priority. You start with airway, breathing, circulation, then you come to a muscular hierarchy of needs, which also have to do with airway, water, food, and shelter, and all those things. So you remember that if you look at all these things, monitor stools, that's defecation, elimination. Fluid, that's water. Urine output, that's elimination. Encourage the client to cough and deep breathe, that is airway clearance. So which one takes priority is airway clearance, which has to do with coughing. So if you understand the way these things go, you will always be able to answer the questions. Assess before you implement. Independent actions before dependent nursing actions. These are the tricks you need to apply, okay? And you will always be able to get your answers right. I'll leave you with a last question, which says a nurse is caring for a client experiencing dystocia. Nurse caring for a client experiencing dystocia determines that the priority is which action. So here again, it's about priority. Most of your questions are going to be priority actions. So be careful about that. So for example, position changes and provide comfort measures. Explanation to family members about what is happening to the client, monitoring for changes in the physical condition of the mother and the baby, reinforcement of breathing techniques learned in childbirth preparation classes. Now, let's take our time and look at this question very well. If you apply your rule of assessment before implementation and apply your rule of dependent nursing action before independent nursing action before dependent nursing action. And apply your rule of patient before equipment or patient before others. Position changes and providing comfort measures. Let's keep that one. Explaining to family members about what is happening. That is secondary. Or if you are prioritizing, explaining to family members, you have to deal with the patient first. So we strike that one out right away. Monitoring for changes in the physical condition of the mother and the baby. We need to keep that one. Reinforcement of briefing techniques learned in, childbirth preparatory classes. So you know that this is about teaching. Patient teaching doesn't take priority to directly dealing with the patient. So we strike that one too out. So positioning changes and providing comfort measures as against monitoring for changes in the physical condition of the mother and the baby. You'll see that monitoring for the changes in condition in the mother and the baby takes precedence to any of this. So therefore, the answer should be C. So you should be able to analyze the question and come out with a valid answer that will help you to arrive at the decision. So all along, I'm saying that this whole essence of this exam is about critical thinking. It's not about picking some set of questions and memorizing and going for the exam. If you do that, you'll have challenge. Try to develop your critical thinking, develop some knowledge, have understanding of the knowledge, build wisdom, get common sense, and you are ready to answer the questions. And when you sit in there, you will be able to come out with the questions. Remember that I have said that this one, if you don't continue to practice some of these things I'm sharing with you, and you just want to memorize the questions and go there, it's not going to be enough. Because knowing is not enough, we must apply what we are learning. Even if you are willing to even apply, it's still not enough. You must just do it. Thank you, and follow my YouTube channel, and let's share the ideas together. I've used these strategies to help my candidates for the past decade, and they've all passed, and they're working in different parts of the world. You will be the next person to pass the licensing exam and all your nursing exams. So encourage your colleagues to subscribe to my YouTube channel, watch my videos, share it among your peers, and we can build together. Thank you. See you next time.